Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be discussing the working interview for new docs. Now, this has been a subject of discussion and debate on one group on Facebook called Dental Nachos, with a lot of people chiming in. Doc Goodman, he's got some different ideas and good ideas about working interviews for docs. And basically what it comes down to is this. You know, when an office is looking for a new doc, and of course a new doc is looking for a job, you want to make sure that it's a good fit for everybody. But what's best? How do you do that? So do you just have somebody show up to work on patients and see how they do when you don't really know how they are clinically? That can lead to a lot of mysteries. You really don't know how well they're going to do. And then if they don't do a great job, now you've got maybe some stuff to clean up as an owner. And of course, that's not very comfortable because you are entrusting your patients, the people you care for, to somebody who's coming in totally, brand new to your office. And maybe things didn't quite go so well. So now you might have people upset with you. So that's the downside to actually having somebody do a working interview with your office. Can be problematic. The plus side to a working interview like that is that maybe your assistants and team members might get to know how this particular person operates, how they work, see how they work, on a very, very, very firsthand basis. And they might be able to say, hey, doc, he's really good, or he or she is really good, or hey, doc, he or she, we're not so thrilled with how things turned out, and it wasn't really going all that well, and maybe we need to find somebody a little bit better. So, of course, there are advantages and disadvantages to both, but of course, if it doesn't go so well, then that could be a real large problem for the office and for the owner doc. So that said, there's the other alternative, which is, at least one other alternative, which is to have a person who is interested in joining your office come and work with the office in the sense that they're really going to be observing in the office for a full day. That is, they'll spend time in every department. They'll spend time in hygiene, just to kind of watch how the hygiene flow is for maybe a few hours, then watch how the operative flow is for a few hours, and then maybe even see the front desk, how the front desk works for a few hours, just to get a full feel of the flavor of the office or the rhythm or flow of the office. And then that way, he or she, the candidate that's coming in, can say, hey, this looks like it might be a place for me, or hey, you know what, this isn't quite my style. I think I need to find another office to work at. So, the pluses, of course, is the interviewee or candidate can kind of get a good feel for the office, and maybe in discussions, the team members can get a good feel for the candidate on a personality level, maybe. Of course, the downside is you still don't know anything clinically about the candidate, so you're kind of stuck on maybe the words of a few letters of recommendation or a phone call with maybe one or two docs that have worked with the person. So it still kind of becomes an enigma one way or another, but one of the things that I do recommend, if you are an interviewee going, on some sort of a working interview where you're just going to shadow and not really do anything, of course, you want to make sure that you get along with the people that you could be working with. And so that's really, really important. So, make sure that you start out on a positive note, that you present yourself well. Of course, neat, groomed, stuff that I shouldn't really say, but, hey, I have to because on occasion you get some strange stuff happening. But, if you're not really a people person and you decide to kind of fake that when you go for your working interview, your shadowing interview, if you happen to get the job and you go on the job, people will kind of figure out after not so long that you were faking it. And then you might get some not so thrilled team members, people who aren't really willing to work with you, and things can go downhill if your team doesn't really like or support you. So, again, don't fake it, be genuine. I have to say, be genuine, be yourself. Make sure everybody knows, hey, this is how I am, and that way they can get a feel for you. And if they like you, great. If they don't, there's going to be an office that will. So one way or another, you will find a place, but don't just jump at the first thing. Don't fake anything. Don't be a fake just to get a job. Make sure the place is right for you, and everything will ultimately work out in the end. So that said, I hope you're all staying well and healthy. Thank you so much for joining me.